Good afternoon, everyone, and welcome to our webinar today on general practice grant opportunities that are coming up through Western Victorian Primary Health Network. We're going to give you an overview on the Practice Leadership Program and some other opportunities. First, I'd like to acknowledge the traditional owners and custodians of the unceded lands and waterways that we're all dialing in and meeting on today. We recognise their diversity, their resilience, and the ongoing place that First Peoples hold in our communities. We'd also like to pay our respects to the elders, both past, present, and we commit to working together in the spirit of mutual understanding, respect, and reconciliation. We support self-determination for First Nations people and the organisations that they work for. Little bit of housekeeping. So today's session will be recorded for probity purposes. The presentation slides and recording will be available following the session. We'd like everyone to please keep their microphones on mute and come off mute at the end of the sessions to ask any questions. The presentation outlined today, so we'll talk about the 3 programs that we'll be offering the grant opportunities in. We'll talk about the process and the timelines of when the grant opportunities will open and close and the process that we'll go through. And then at the end, we'll have some question times. So today we have myself presenting. So I'm Katrina and I'm the lead for Workforce Development. Fiona Quigley, who is our Senior Manager of Workforce Development, and Erin Crimmins, who's also a Workforce Development Consultant. So the first grant opportunity that we'll be releasing is the Introduction to Practice Leadership program that will be delivered by Chris and Rod from Bollen Health. The opportunity will be open to 20 general practices within our region to participate in the Practice Leadership program. It runs for a period of 5 months, so from July through to November. All services that run general practices, inclusive of community health services and Aboriginal community controlled organisations, are eligible to apply. General practices that are in MM 3 to 7 are highly encouraged to apply. The program is quite comprehensive, and within the 5 months, there's some pre-work required to be completed by participants. There'll be some practice data reviewing, so that will be before this first session and final session, and West Victorian PHN's digital health team will support you in this. There'll be 4 2-hour Zoom-based interactive sessions delivered by Bollen with Chris and Rod, and there'll be 5 30-minute coaching sessions that will also be delivered via Zoom or telephone. The dates that you must be available for the interactive sessions on Zoom are on your screen at the moment, and they run from 6:30 to 8:30 p.m. This program does have self-logged CPD hours, and it covers off all education, activity, reviewing performance, and measuring outcomes. So it is accredited, and you will have a certificate of participation to log those hours. The support that you'll get from Western Victoria Primary Health Network is we will be covering the full cost of the program for your practice. Our digital health team will work closely with you to undertake the practice data reviews, including the online session on Thursday, the 21st of August. And that will be looking at the data extraction tool through your software Polar. We'll have our practice facilitation team support you to undertake the program, and they'll work closely with you. And you'll also have workforce development team to provide further education and continue to embed the learnings and activities post the program. The expected outcomes of the program, so there'll be a larger increase of engagement from your nurses, administration team and general practitioners. Planning for improving the care provided within your practice. You'll be able to identify and solve problems within your practice, and it will improve communication. There's some testimonials here from some general practitioners and practice managers that have previously been involved in the program. So I'll just leave that up for a minute for you to have a look at. So the steps for the expression of interest. So the expression of interest will open on the 23rd of May, and that will be sent out to all practices, and it will stay open for a period of 3 weeks. So it closes on the 13th of June. Within the next week, you'll be notified of the result of your application. So whether you're successful or unsuccessful, you will be notified. And then the commencement of the program is the 17th of July, and the end of the program is the 30th of November. So that involves participating in an evaluation. So that will all be included in that. I'd like to hand over to Fiona now to talk about our general practice vaccination grants.
Thanks, Katrina, and hi, everybody. I have on offer a general practice vaccination grant. It's for practices to express interest in applying to increase the COVID-19 vaccination rates in their practice. Other vaccination rates for their patient population can be included. It's open to all services that run general practices, inclusive of, as Katrina mentioned earlier, Aboriginal community-controlled organisations. Practices may already be providing COVID-19 vaccinations, or they may be willing to provide this through registering through the Department of Health and Aged Care. So the grant will run from July to November of this year, and it aims to increase the vaccination uptake in the following activities. So you must increase COVID-19 vaccination uptake in your practice. You may also work on increasing childhood immunisation rates. You can also use the grant to support COVID-19 vaccination uptake at local aged care homes. You may use the grant to support the purchase of equipment to support your vaccine delivery, and that might be a portable fridge that you might want to use if you're travelling out to aged care homes or off-site. And it's also available for practice staff to attend immunisation updates for education that include COVID-19 vaccination. So the grant will include a $5,000 payment to successful practices that meet the following requirements. You do need to have staff protected time from normal duties to allow you to plan and to deliver the vaccinations. You'll need to agree to the quarterly in-person practice visits from your practice facilitator to provide support and to see update on progress of activities. You must use the GoShare patient health literacy tool as part of the activities associated with the vaccination grant. So if you don't currently have a GoShare licence, WVPHN can provide you with one. You need to be willing to share insights or models developed either through online or face-to-face learning at our organised workshops with colleagues. That might be through the current practice nurse and practice manager networks that we run each month, or it might be an article that we feature in one of our newsletters. You'll need to provide a short report on how the funding has supported the clinic to increase COVID-19 vaccinations. And where practice can't provide evidence of completed activities, despite the support provided by the PHN, we would have to consider recalling the grant funding. The support that the PHN will provide to successful practices, you'll have our practice facilitation team to provide support and seek update on progress on activities. And you'll have support from the workforce development team with educational opportunities. So we're running Managing Immunisation Emergencies training in July and August. And we also have the online immunisation forum in June. There's, of course, lots of other external education you may wish to seek out, and we're supporting practices with the payment of the $5,000 grant. So the timeline for this grant is very similar to the first one. Expressions of interest will open later this week. They'll be open for 3 weeks and close on the 13th of June. We'll be notifying successful and unsuccessful applicants on the 19th of June. And then the program will commence, or the grant period will commence on the 1st of July and end on the 30th of November. I'm going to hand over to Erin now to talk about the next program.
Thank you. Hi, everybody. We're going to be partnering with APNA to offer up to 8 organisations the opportunity to participate in the Cultivate Nurse Clinic program. And it's going to run from August to December of this year. So the opportunity is open to services that operate general practices, including Aboriginal community-controlled organisations. It's an 8-week hybrid learning experience designed to support nurses in developing and implementing nurse-led clinics. Weeks 1 and 8 will both be delivered as in-person workshops, while the remaining 6 sessions will take place online. And each week focuses on a different theme, covering planning, staffing, patient engagement, funding, data collection, and evaluation. And the program will conclude with presentations from each of the participating practices on their proposed clinic model. The program requirements, so each successful applicant must participate into 2 face-to-face sessions in Ballarat on Tuesday the 14th of October and Tuesday the 9th of December. Must also attend and actively participate in the 6 one-hour online sessions that will be held weekly from week 2 to 7. 2 staff members must be able to participate, preferably a nurse and a practice manager, and they must have protected work time from normal duties to participate in the training. You'll need to have access to a computer with internet, camera, and audio functions, and be willing to deliver your nurse-led clinic implementation plan in week 8, as well as share your insights or models developed through online or face-to-face learning at our organised workshops. So the support from West Vic will be covering the full cost of the program course fees and offering a $1,500 incentive payment to support the involvement in the program, including attending the workshops. You'll be offered support from your practice facilitation team and the digital health team to plan and implement your nurse-led clinic. And if you don't already have access to GoShare, we will provide you with a license. So the timeline for this one is similar to the other 2. The expression of interest will open on the 4th of August and be open for 3 weeks with the closing date of the 25th of August. We'll notify you whether you're successful or unsuccessful by the 1st of September, and the program will commence on the 14th of October, ending by the 12th of December. There will also be a 3-month evaluation done after the end of the program.
Thanks, Erin. Thanks, Fiona. We've just got up on the screen some upcoming events that might be interest of you. So we've got the Better Billing series that we have Dr. Ash present, and they're an ongoing series. We've got some triage training happening via Zoom, and a JPACE webinar also happening. Our face-to-face skills sessions at the moment, we've got the Practice Managers Networking and Education 7-part series, so that we're I think we've still got 7 sessions to go with that, and that's been running throughout this year and concludes in December. And we've also got mental health first aid training in July, so that's across our entire region happening. Our Project Echo Eating Disorders is on Tuesday mornings, and that's still running, and you're welcome to register for that. So all our events are on our website, and we'll pop a link into the chat. We also put out a couple of weeks ago our save the date for our primary care conference that is happening in October, Friday the 10th and Saturday the 11th. So we've locked in some really good keynote speakers for that. It will be a full day on Friday, followed by a half day on Saturday morning and skills on sessions on Saturday afternoon. Registrations for that and the program will be out from the 2nd of July. And last year it was a really, really successful event, and we had over 160 people attend from across the region. So now we're going to open it up for questions regarding any of the grant opportunities that you may have questions about, and we'll answer them for you.
Can I just, with the COVID vaccination grant or the immunisation grant, the only thing is at the moment, like it's flu vax time, so of course everybody's wanting to have their COVID vaccinations at the same time as they're having their flu vax, and so it's kind of almost like it's, you know, we've missed that mostly where people are wanting to get their COVID vaccinations.
Hi, Catherine. Is that because you mean they've been in to have their flu vax?
Yes, yeah.
Yes, yeah, okay, yeah, I see where you're coming from. That may be a bit challenging. Yeah, I think the intent of the grant is to, you know, for you to attempt to increase COVID vaccination. So you can address the other areas that are listed. But I appreciate that, yeah, you may have missed an opportunity with the flu, but I suppose it's about making it available where you can. So
Yeah.
yeah, offering it out, but I understand, yeah, where you're coming from about the timing of it.
Yeah, just the timing of it. I mean, look, I mean, we can still like, you know, I mean, we'll still always have it to be able to offer it.
Yeah.
And I mean, of course, you know, some people, you know, go, oh, well, I'll wait until, you know, I'm going overseas, and then they'll decide they go, you know, they want to have it or whatever. And I mean, so when we're saying vaccination rates, so that would be fine with any vaccinations, like increasing, like Shingrix uptake, any of those things.
Yeah, any vaccinations that you want to try and increase the uptake rate, it would just be that you do need to focus on, you need to include COVID vaccinations as well.
Yep. Okay.
Thank you. There's just
I see a question in the, that's all right. I just see a question from Chloe in the chat about COVID. You don't do COVID vaccinations. Would we be eligible? You would need to register, Chloe, to be a vaccinating clinic for COVID-19, which we can supply the details with. So you would need to include COVID vaccinations if you want to also focus on others. So it's open for general practices and ACCHOs who are either currently delivering COVID-19 vaccines, or you can register to be a vaccination clinic. Yeah, so the grant will run from July to November, and these are the activities. So you must support COVID-19 vaccination uptake, and you may also address the other childhood immunisations. You might want to look at flu and shingles and measles and all sorts of vaccinations. You may want to address supporting residents in aged care homes with their COVID-19 vaccination. You can also purchase equipment, or you can use the money to attend education. And this is sort of the requirements, I suppose. Get support from your practice facilitator with your quarterly in-person visits. So you must use GoShare. Some practices are already using it. If you're not, we can provide you with a license. And that's around providing information to patients around vaccinations, specific ones you're providing. You can send them SMS or email information about when's the right time and what sort of vaccines they might be eligible for. The timeline is opening later this week, and will open for 3 weeks, and then we'll commence the funding at the beginning of July and run through to November.
Just a question around the MM3 to MM7.
Do you need to be? You don't need to be, Peter, but we're just recognising that the challenges of everyone. I understand everybody has recruitment challenges of staff, but we recognise that living in a more rural area, 3 to 7, you often have greater difficulty with that. But you can be in an MM1 or 2 and still apply. And the practice leadership program, would this be open to practice? Yes. So it's really a whole of practice approach. So we would really like the practice leadership team to be involved, and that might be a GP, a practice nurse, and your practice manager.
So if there's no further questions, we can end the session now, but feel free to reach out to Workforce Development in the next 2 days before the grant opportunities come out. Otherwise, the grants will have a email address that you can contact whilst the grant is open for any questions that you might have. So, yeah, thank you all for attending, and we hope that's provided you with some valuable information for your submissions to the grant. Thank you.